Peace to everybody. This is about a daily aspirin to prevent heart attacks, no longer recommended for older adults. And if you're an older adult, you are not recommended to take a daily aspirin for heart attacks, to prevent heart attacks. If you're a healthy older adult looking for ways to reduce your risk of heart attack and stroke, don't turn to that age-old standby. Daily low-dose aspirin is no longer recommended as a preventative for older adults who don't have a high risk of existing heart disease, according to guidelines announced Sunday by the American College of Cardiology and the American Heart Association. So this old saying is that the low dose aspirin, you could take it, but now it's no longer recommended. You don't have to take it to prevent heart attacks or anything like that. For the most part, we are now much better at treating risk factors such as hypertension, diabetes, and especially high cholesterol, says North Carolina cardiologist Dr. Kevin Campbell, who wasn't involved in the new guidelines. This makes the biggest difference property negating any previously perceived aspirin benefit in primary prevention. So Dr. Campbell was not in the guidelines, so I guess they told him, oh no, you don't have to be in it, or they must have left him out by accident. It all depends though. But now that they're doing the risk factors, checking for hypertension, diabetes, and cholesterol, so those are the main ones right now that they're studying on. Doctors may consider aspirin for certain older high-risk patients, such as those who have trouble lowering their cholesterol or managing their blood sugars, as long as there is no increased risk for internal bleeding. The guidelines say European guidelines recommend against the use of anti-clogging therapies such as aspirin at any age. So the European guidelines, they're totally against it, but not too much against it. So it's for the clogging therapies such as aspirin as at any age. So it doesn't matter what age as they're trying to avoid it, but it's all ages that we know of. Clinicians should be very selective in prescribing aspirin for people without known cardiovascular disease. Johns Hopkins cardiologist Dr. Roger Blumenthal, who co-chaired the new guidelines, said in a statement, "It's much more important to optimize lifestyle habits and control blood pressure and cholesterol as opposed to recommending aspirin." So they just want you to control what you have. Just keep it under control. Don't take low dose aspirin, and these cardiologists are just opposed to recommending aspirin. Using aspirin in younger age groups is now a Class 2B recommendation, Campbell said, meaning that it is not necessarily the best course of action. There is much debate among experts and the data is not definitive. So there's a debate over these between the experts about the aspirin, if it's good for you to take it or it's not good for you to take it. They're just saying right now that it's not recommended for you to take the low dose aspirin. However, personally, Campbell says he would advocate a healthy lifestyle, smoking cessation, and risk factor modification before even considering aspirin therapy in a patient without known cardiovascular disease. Well, first of all, smoking is bad for you. I know because there's like 7,000 chemicals in a cigarette, and it's just too much. But now the modification for, like, even considering aspirin therapy, so for the cardiovascular disease. However, for anyone who has had a stroke, heart attack, open heart surgery, or stents inserted to open clogged arteries, aspirin can be life-saving. So if you had a open heart surgery and has stents inserted into your arteries and that, you can be allowed to take it because it can be life-saving for that reason. Ultimately, we must individualize treatment for each patient based on their individual situation, Campbell said. So they have to treat the patient individually, so this way they can know what is good for them. 3 recent studies found that taking a low-dose aspirin is, at best, a waste of money for healthy older adults. At worst, it may raise their risk of internal bleeding and early death. So this is what the aspirin is doing to them now. It will make them, for the older adults, to have internal bleeding and an early death, and that's why it is not recommended for that, because that's what can happen. Aspirin should be limited to people at the highest risk of cardiovascular disease and a very low risk of bleeding, Blumenthal said. So yeah, it's going to have to be eliminated to people. So this way you could have a low risk of it. Patients should work closely with their doctors to establish their risk of bleeding. That risk rises as one ages or develops kidney disease, heart disease, diabetes, and high blood pressure, a history of ulcers or bleeding, especially in the gastrointestinal tract, or anemia is also a risk factor. Certain medications such as non-steroidal anti-inflammatory drugs, steroids, direct oral anticoagulants, and warfarin, a blood thinner, can also increase the chance of bleeding. So there's risk factors for other medications, even if it was for aspirins as much as well. But there's kidney disease, heart disease, diabetes, and high blood pressure. So those are, and of course a history of ulcers. So you've really got to be careful what medicines you're taking, and ask your doctor about what medicines are safe and what medicines are not safe. The guidelines stress that statins, along with lifestyle changes such as a healthy diet, regular exercise, weight loss, and avoiding smoking or vaping tobacco, should be used to prevent heart disease in anyone with LDL levels of more than 190 milligrams per deciliter. LDL stands for low density lipoprotein. I don't know. Like, I'm just having words to pronounce, and is the bad cholesterol that clogs arteries and leads to heart disease. So you have to be careful. And I guess the only thing you can do is avoid smoking cigarettes or even vaping tobacco. So it's a good thing. If you have LDL levels of more than 190 milligrams, then yeah, there is gonna be problems. Type 2 diabetes is a primary risk factor for cardiovascular disease, and the 2019 guidelines stress a diet, exercise and weight control plan is the first line of offense. Strive for at least 150 minutes a week to moderate intensity exercise such as brisk walking and swimming, the guidelines say. Then tack on another 75 minutes of high intensity exercise such as running and circuit training. Excuse me. So getting some exercise in does help, and that you could take a walk or you can go swimming. It all depends on which one you rather do. And it's a high intensity exercise such as running and circuit training. That's and plus you need to eat a healthy diet as well. First line medication should include metformin. The guideline says if additional medications are needed, two new classes of medications are showing promise in reducing cardiovascular events in those with type 2 diabetes. SGLT2 inhibitors, which work to increase glucose and sodium removal via the kidneys, and GLP 1R agonists, which increase insulin and glucose production in the liver. So you really have to be careful what you do with if you have diabetes, and this could do a lot of risk factors. But I would recommend just please be careful what you do, because it could affect the kidneys or any other part of your organs inside of you. New research on these two classes of diabetes medication shows that they can also cut the risk of heart attack, stroke, and related deaths, the guideline says. So that's a good thing also, that the diabetes can also cut the risk of heart attack and stroke as well as related deaths. So that's a good thing to have. To have these medications that you need to take every day. And just be careful with the medicines that you are taking, because you never know when something is going to happen and what can happen to you or anybody else. Please tell me what you think in the comments below. I am out.